Inwagata no Sahai is still my amiable name, and I'm so delighted to come your way this morning and make your day a premium value one. Now, within the workplace context, emotional intelligence is your ability as a boss or as a leader to achieve workplace emotional stability with the knowledge of how to manage your emotions and the knowledge of how to manage the emotions of your team members. And since about a month now, we have been looking at driving workplace productivity with emotional intelligence, and we have been doing it from a very practical perspective, using case scenarios to look at it. We have been focusing on the emotional intelligence pillars, the foundation of self-awareness and then also self-regulation. Self-awareness is your ability, to recognize your impulses, the ability to recognize your emotions and understand how those emotions impact on output, how it affects your behavior, how it affects your workplace performance, how it also affects other people. While self-regulation is your ability to manage and control your emotional reactions, the ability to control your impulses, and ensure that at the end of the day, amazing result is achieved. This is very important, especially for you as a boss. And we are still zeroing on that self-awareness and self-regulation, and we are going to zero the case study on it today, on the radiology department of a Nigerian teaching hospital. With the case scenario today on self-awareness and self-regulation combined is on in the radiology department of a Nigerian teaching hospital. So I tagged it exhibiting self-awareness and self-regulation in the radiology department of a Nigerian teaching hospital. Exhibiting self-awareness and self-regulation in the radiology department of a Nigerian teaching hospital. So the case scenario goes thus. It's a peak period in the teaching hospital. Patients are arriving in large numbers. Referrals, emergencies, and follow-ups. In the radiology department, tension is already high. Then it happens. The department main CT scanner suddenly breaks down. This isn't just any machine. It's the backbone of diagnosis for trauma cases, strokes, internal bleeding, and emergencies. And this machine is old, affected by erratic power supply, poorly maintained due to delayed funding. Within hours, scans begin to pile up. The crisis just escalates. Patients wait. They wait and wait. Some have fasted since morning. Others are in pain. Relatives begin shouting in the waiting area. Threats of reporting the hospital to management and even the media start flying. Inside the department, inside the radiology department, radiographers are exhausted. Technicians are overwhelmed. Shifts stretch endlessly. Allowances are unpaid. Quiet conversations begin among, inside the radiology department. Should we down tools? Is anyone listening to us? Now, this is how crises usually just explode. Then let's see how self-awareness played out at that radiology department. Self-awareness at the departmental level. Now enter the head of the radiology department. He has seen this before. Equipment failure, funding delays, pressure from all sides. His first emotion is anger, deep anger towards hospital management. But then something important happens. He pauses. He reflects and realizes, I am angry because I care about patient safety and my team. But if I react emotionally, I will make this worse. That moment is self-awareness. The ability to recognize your emotion and their impact on outcomes. And that is what the HOD of the radiology department of the Nigerian teaching hospital in this case scenario did exactly. He said if he reacts emotionally, he is going to make things worse. That moment is self-awareness. He recognizes what he's feeling, why he's feeling it, how acting on it could harm others. Then self-regulation also in that radiology department by the HOD of the radiology department in the Nigerian teaching hospital in this case scenario. Instead of lashing out, the HOD chooses control. It takes few moments alone to breathe and reset. Then he calls a short team huddle and says, I know we are all stretched thin. It's not fair. But let's focus on what we can control right now. This is really emotional intelligence at play. No shouting, no blame. He redistributes workloads, prioritizes emergency cases, introduces temporary alternative imaging methods. The atmosphere shifts from chaos to coordination. That is self-regulation. Self-regulation is your ability to control your impulses towards seeing that you achieve desired outcome at the end of the day. Very, very important. Now, let's see pressure at the top. Meanwhile, the chief medical director receives urgent reports, complaints, threats, pressure from boss and external authorities. His instinct, the CMD instinct, his instinct demand quick fixes, summon the HOD, ask hard questions aggressively. But again, pause. Through self-awareness, that is the CMD now, the chief medical director, through self-awareness, he realizes this pressure is coming from fear of reputational damage. He understands that a command and control response common in hierarchical systems could silence the truth. Self-awareness, understanding how it's going to affect outcomes. Very important. Then self-regulation from the CMD. Instead of calling for confrontation, the CMD does something different. He goes to the department personally. Now, this is leadership. He went to the shop floor. He goes to the department personally. He listens. He doesn't interrupt. He doesn't defend. He says, I see how this is affecting everyone. I share your frustration. Now, listen. That simple validation lowers tension immediately. Working with the HOD, the chief medical director approves temporary equipment support from a nearby private facility, escalates emergency funding diplomatically, signals support rather than punishment. Now, the outcome of self-awareness and self-regulation steps by the CMD. Within 48 hours, the scam backlog is cleared, patients' complaints reduced, staff morale improves, a potential strike is avoided. More importantly, trust is rebuilt. What could have become a public scandal becomes a learning moment. This is amazing. This is powerful. So let's glean the lesson from this case scenario. We are looking at self-awareness and self-regulation case scenario in the radiology department of a Nigerian teaching hospital. So self-awareness lesson 1. Leaders must recognize their emotions triggers like anger, fear, and embarrassment before acting. Unchecked emotions often worsen situations without bringing solutions to the table. Self-awareness lesson 2. Understand why you feel pressured. Understanding why you feel pressured helps you respond wisely. This is very key. Self-awareness lesson 2. Understanding why you feel pressured helps you respond wisely. Self-awareness turns emotional reactions into thoughtful leadership. Very important. Then the self-regulation lesson from the case scenario. Self-regulation lesson 1. Calm leadership stabilizes teams during crisis. When leaders control their emotions, staff feels safe to speak and cooperate. I will read that again. When leaders control their emotions, staff feels safe to speak and cooperate. In other words, psychological safety is brought into the narrative, into the conversation. Psychological safety is a situation whereby people are not afraid of backlash when they speak, the truth. Very important. Self-regulation lesson 2. Self-regulation shifts leadership from reaction to resolution. It creates space for problem solving, collaboration, and trust, even when systems are failing. This is just so important. Now, in conclusion, self-awareness helps leaders understand themselves. Self-regulation helps leaders manage crisis. Together, they don't just fix problems, they keep people working and systems standing. This is very important. This is the reason why every leader needs to learn about emotional intelligence and be able to know how to apply it. Remember, Within a workplace context, emotional intelligence is your ability as a leader to achieve workplace emotional stability with the knowledge of how to manage your emotions and the knowledge of how to manage the emotions of your team members. And this is exactly what the HOD of the radiology department in the teaching hospital and also the chief medical director of this teaching hospital in this Nigeria case scenario has done. They were able to achieve workplace emotional stability through the knowledge of how to manage their own emotions and the knowledge of how to manage the emotions of their team members and even the knowledge of how to manage the emotions of patients. And at the end of the day, the system stabilized despite the shaking, despite the chaos. At the end of the day, the system stabilized. I seriously believe that profound value have been added to you today, like you always do. Send your questions, send your inquiries to my email, inoagata@gmail.com, and then I'll provide answers to you. We'll build a better workplace for ourselves, build a better system and working nation for ourselves, and even a better world for ourselves as well. I'll be seeing you next week, Wednesday, and when I return, I will say remain the amiable, Inoagata, no Sahai. Your day is so blessed. Thank you.